If medical management of the fibroids doesn't work, or if you desire to not use medication to treat your fibroids, then fibroids will be treated surgically. There are numerous different ways that fibroids are treated surgically. So let's go from the least invasive to the most invasive. The least invasive is something called uterine artery embolization. Uterine artery embolization is used to try to cut off the blood flow to the individual fibroid, and that should shrink the fibroid down. And that's done by threading a catheter through an artery and threading it up through the artery to the artery that's feeding that fibroid. It's usually done through the groin, although it can be placed in other places. But basically, a little catheter is pushed through the groin. This is followed with radiologic equipment. And dye is pushed through the catheter, and that dye is followed down the artery to see where it goes. The catheter is threaded around until the actual artery that's feeding just that fibroid is found. And then a device is placed to basically block that artery. The catheter is then removed, and you should be able to go home the same day. Over time, usually over a month to 6 weeks, that fibroid will then degenerate, which means that it will die and shrink down. Unfortunately, that can be very painful because dying tissue can be extremely painful. However, there isn't a big incision to heal, and it saves the uterus in full. So the advantage of uterine artery embolization is that it's an outpatient procedure. There isn't a lot of recovery per se, and it maintains the function of the uterus. The downside is that, number one, it only treats the fibroid that they can get the artery to. Sometimes it's difficult to find the artery that feeds that individual fibroid. And it's only going to knock out the fibroid that they find. And so there may be other fibroids that are still present. There also tends to be a lot of pain over the first 4 to 6 weeks as that fibroid degenerates. And there's nothing to stop a new fibroid from growing up. And women that have symptomatic fibroids tend to be fibroid growers. So even if you treat one, another one can come back. But it certainly can work for a symptomatic fibroid, particularly if you have one dominant fibroid. This can be a reasonable option for treatment. Another surgical option is something called a myomectomy. Now, another name for fibroid is myoma. And so myomectomy is removal of the myoma or removal of the fibroid. And basically, this involves removing the fibroid from the uterus, but leaving the uterus intact. This can be done laparoscopically. It's probably more commonly done through an open incision, where an incision is made like a C-section incision. The uterus is brought up, and then the fibroid is basically carved out of the uterus, and then the uterus sewn back up so that that defect is closed. The advantage of myomectomy is that it keeps the uterus intact so you can still have children. The disadvantage is it's actually a fairly big surgery. There can be quite a bit of blood loss, and occasionally you'll need a transfusion from this surgery. It also leaves a scar on the uterus so that if you get pregnant, usually a C-section will be required. And because it leaves the uterus there, there's a pretty good chance that eventually more fibroids will grow back. The myomectomy is a very good surgery for women that have a dominant fibroid and want future childbearing. So it's a way to remove the fibroid but leave the uterus in so you can still have children. The most common surgery for fibroids is a hysterectomy. Now, a hysterectomy is removal of the uterus from the woman's body. Now, the advantage of hysterectomy is it will absolutely get rid of the fibroids. It's the one thing that we can do that guarantees that your fibroids are gone and won't come back. It will also absolutely stop your vaginal bleeding, whereas the other treatments may or may not work. The hysterectomy always works for that. It is, however, a much larger surgery, and you don't have a uterus. So if you still want to have children, you absolutely cannot have a hysterectomy. But if you're done having childbearing, usually the hysterectomy is the most appropriate treatment for fibroids. Now, hysterectomies can be a total hysterectomy or a partial hysterectomy. And when doctors say this, they mean a little bit different thing than what you probably think of. Total hysterectomy means that the uterus and the cervix are removed together, whereas a partial or a subtotal hysterectomy, also called a supracervical hysterectomy, is to remove the uterus but leave the cervix intact. The ovaries are a completely separate issue, and we can always leave the ovaries in even if we take the uterus out. And so a hysterectomy without taking the ovaries out still gives you the normal hormonal function that you're used to. And so it doesn't change your hormonal milieu even though we remove the uterus. All it does is get rid of the fibroids in the uterus and make it so you don't have menstruation. The advantage of removing the cervix is it is possible to get fibroids on the cervix. And so if we leave the cervix in with a hysterectomy, it is possible over time that you could have new fibroids grow over the cervix. And so that is no sort of complete guarantee that the fibroids won't come back. But if we do a total hysterectomy, remove the uterus and the cervix, then we can basically say pretty much for sure that you aren't going to get fibroids in the future.